Deployment bans, Filipino nurses have expressed their exhaustion and dismay with statements as, "We don't feel that we are cared for. We feel exhausted." But we always keep in mind that we have to help our people because no one else will. This flight of health workers from healthcare institutions had severely affected the local COVID-19 response. Hospitals in the country have already started to downsize their operations, not because of the lack of facilities or health equipment, but because of the lack of healthcare workers. Welcome to our webinar, Leveraging Professional Development to Reroute Nurses from the Great Resignation, hosted by the St. Anthony's College and the Filipino Nursing Diaspora FiND Network, in collaboration with the Association of Deans of Philippine Colleges of Nursing, ADPCN Region 6, the Philippine Nurse Association, PNA Region 6, Association of Nursing Service Administrators of the Philippines, and SAP Iloilo Chapter. This free webinar is approved with 3 CPT units for our nurses. And to start, may you request everyone for the singing of our Philippine National Anthem to be followed by a prayer.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, helas ng silanganan, alam ng puso, sa dikit mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa mandulupin, di ka pasisingil, sa nagatang tutok sa simoy at sa langit ang pangaw, ay hinatang tula, kawin sa paglayang minamahal. Ang isang ng matawad mo'y tagumpay na nag-iindig, ang bituin at araw niya kailan pa may di magdidinig. Luman ang araw ng warhabit pagsingka, buhay langit sa piling mo. Ang hindi kaya ng pagkay mga aking, ang mamatay ng dahil sa'yo.
thine was the gift to thee. I all resign. What thou wilt command, and I obey. Only thy grace, thy love on me bestow. These make me rich, all else will I sa iyo, sa hindi ko handog sa iyo. Ano bayan mo't pagkarihan lahat ayon sa kalooban mo. Nagutos ka, Panginoon ko, naging tatalima ako. Ipagkaloob mo lamang ang pag-ibig mo at lahat tatalim na. Naging tatalima ay tatalimtan ko.
Once again, ladies and gentlemen, good morning and welcome to our webinar, Leveraging Professional Development to Reroute Nurses from the Great Resignation. This webinar will tackle the various contributing factors that are causing nurses to leave the profession, also known as the Great Resignation. It will also evaluate the current strategies employed by healthcare leaders and organizations and their effectiveness in addressing and managing the exodus of nurses. Furthermore, this session will also discuss the viability of providing professional development opportunities to nurses to promote nurse retention as well as their expertise. Lastly, this session will also provide nurses with guidance on how to start their professional development journey if they are considering rerouting their nursing careers. We have 8,000 in total for our webinar registration, and as of the moment, we already have 3,000 participants in our Zoom meetings. We'd like to recognize our participants, so we will start with our participants coming from Luzon. Our Filipino participants, kindly type in your names or the institution that you belong to be recognized. Again, our participants from Luzon, we have participants coming from the Mountain Province, from Albay. Another is from Pangasinan, Laguna, Bulacan, Batangas. So welcome to our webinar from Cavite and Baguio, Lucena City, Manila. So we have a lot of participants coming from Luzon, and welcome to our webinar. What about our participants coming from the Visayas? From the Visayas, we are from Capiz, Iloilo City, the host of this year's PNA National Convention, Negros Occidental. We have Bacolod, Aklan, and of course here from the province of Antique. What about our participants coming from Mindanao? Our participants from Mindanao. By the way, we also have participants coming from Cebu, from Bohol, and from Mindanao we have from Davao City, from CDO, Dipolog, General Santos, from Buanga City, from Digos, Tacloban, Pagadian. Now we have a lot of participants. What about our participants coming from other parts of the world? Our Filipino nurses distributed all over the world. From Canada, from Oman, welcome. From the US, from Brunei, from Taiwan, from Canada, from Malaysia, from Germany. So everyone, welcome to our webinar. So to formally welcome us, let us now listen to a message to be given by the President of the Filipino Nursing Diaspora, or FiND Network. Ladies and gentlemen, a virtual applause, please, for Professor Violeta A. Lopez. Once again, ladies and gentlemen, let us listen to the President of the Filipino Nursing Diaspora Network. Again, a virtual applause, please, for Professor Violeta A. Lopez. Dr. Lopez?
Good morning and good day to all attendees, wherever you are accessing this webinar today, entitled Leveraging Professional Development to Reroute Nurses from the Great Resignation by our great invited speaker, Dr. Jose Arnold Tariga from Atlanta, Georgia, USA. The World Health Organization in 2020 reported that although global nursing workforce is projected to increase to 35.9 million in 2030, there is still a significant shortage of nurses to meet the current demands. The ICN in 2021 estimated an expected increase in nursing shortage to a total of 13 million within the next 10 years, due to anticipated retirement and the threat of the exodus of the COVID-19 pandemic in the current healthcare setting. Nover et al. Reported that one of the keys to bringing the gap between nursing workforce supply and demand is reducing turnover or resignation and improving retention. Nurses leave the profession by remaining unemployed, letting their professional registration lapse, or taking up a non-nursing occupation. Various studies across different countries have shown an increase in the nurses' intention to leave due to increased workload, burnout, and distress, as well as unsatisfactory work environment and lack of support from their managers. The ICN recommends immediate action to improve nursing retention and mitigate turnover or resignation through professional development, a specialty of nursing practice defined by standards based on research and critical to quality, patient, and organizational outcomes. Professional development is central to nurses' lifelong learning and constitute a vital aspect of keeping nurses' knowledge and skills up to date. Maloney and Woolford describe the history of nursing professional development, reflecting the past, present, and future. The major pillars of professional development were on the role delineation or role clarity, managing transition to practice, leadership, and value propositions. There is also a continued emphasis on interprofessional education, collaborative practice, and evidence-based practice. Some strategies have been suggested in providing professional development to nurses, to engage in blended learning programs to enhance learning, using appropriate and useful learning outcome metrics, strategies to sustain behavioral change and work satisfaction. While we know about the needs for nurses' professional development, less is known about how nurses experience and perceive professional development and strategies to leverage nurses' experiences and view professional development so as to provide a basis for planning future professional development interventions more effectively and take advantage of examples from different contexts. I am sure that our guest speaker today in this webinar will provide us with more information on how to reroute nurses from resignation by strategies to leverage the great resignation of our nurses through professional development. As the president of the FiND network, I would like to extend also the board of directors of FiND sincerest appreciation and thanks to St. Anthony's College, PNA Region 6, PNA Antique Chapter, and ADPCN Region 6 for organizing and collaborating with this great seminar. To all participants, please listen carefully. Take home the important messages from our great speaker today. Thank you and have a good day.
Thank you very much, Dr. Violeta A. Lopez, the President and CEO of the Filipino Nursing Diaspora Network. The Filipino Nursing Diaspora Network is a global resource network of scholars and leaders providing support in clinical practice, administration, research, and education. They assist in the formation of Filipino nursing groups in different countries. Once again, thank you very much, Professor Violeta A. Lopez, the President of the Filipino Nursing Diaspora. At this point, let us now listen to the Governor of the Philippine Nurses Association Region 6. Ladies and gentlemen, virtual applause, please, for Dr. Rosana Grace Bello de la Riarte.
To Dr. Violeta Lopez and the rest of the officers of the Filipino Nursing Diaspora Network, the officers of the various chapters of the Philippine Nurses Association in Western Visayas or Region 6, officers of the ADPCN, the Association of Nursing Service Administrators of the Philippines, PANAY, fellow nurses from all over the world, students, graduate students, friends, ladies and gentlemen, maayong aga sa inyong tanan from the City of Love, Iloilo City. It is with great pleasure that I greet all of the 3.2 or 3.6 thousand nurses who are now hooked into the Zoom platform for this webinar. We welcome you to another opportunity of sharing and learning as we dissect a very relevant issue concerning nursing nowadays. The word resignation is trending in nursing today. Come to think of it, it is not only the concern of those in the higher echelon of the nursing hierarchy of nursing management, but the shortage of nurses also has effects on the health of the general population as a whole. Thus, mitigating the rapid turnover of nurses is very crucial to our healthcare delivery system. We are happy that we have with us our esteemed resource speaker, Dr. Jose Arnold Tariga, to tackle this topic today. Thank you, sir, for the desire to share despite the difference in our time zones. This is the second continuing educational activity for 2023, and we are very happy that the Filipino Nursing Diaspora Network has continued the linkage with us in conducting activities like this that would promote the growth of our nurses. We also acknowledge the great help of St. Anthony College, PNA Antique, and the support of ADPCN 6 and ANSA Panay. Rest assured that PNA 6 will always be there for its members. Today, March 18 is a holiday in Panay, as we are commemorating the liberation of Panay from the Japanese forces during World War II. What a very fruitful way of spending a holiday through this professional development activity. Wishing you all a very productive Saturday. Happy listening, happy learning, everyone. Good day.
Thank you very much. And once again, that was Dr. Rosana Grace Bello de la Riarte, the governor of the Philippine Nurse Association Region 6. Dr. Bello would like to take this opportunity also, if we can invite nurses to attend in the National Convention of the Philippine Nurse Association. Doc Bello?
Yes, we are bringing the Philippine Nurses Association National Convention nearer to the people, to the nurses in Western Visayas or in Visayas in Mindanao. And for October 2023, it will be held in Iloilo City at the Iloilo Convention Center. We will soon give out the details of the convention, but please mark the date. It's going to be on October 24 to 26, right here in the City of Love, Iloilo City. We hope to see you here in Iloilo on October 24 and 26 for the National Convention. Thank you.
Thank you very much, Dr. Bello. So to our fellow nurses, see you in the City of Love this coming October 24 to 26 for the Philippine Nurse Association National Convention. Thank you very much. And now, ladies and gentlemen, let us listen to the President of the Association of Nursing Supervisors and Administrators of the Philippines, Iloilo. A big round of applause, please, on behalf of Helen A. Caton, Ms. Romelyn Matutina.
On behalf of the Association of the Nursing Service Administrators of the Philippines Iloilo Chapter, a pleasant morning to each and every one of you. It is indeed an honor to be part of this another learning opportunity for us nurses, who may somehow at this time may reflect, is this really my calling? It is no secret that nurses are the most important people in the healthcare systems. We are the ones on the front lines, providing care to our patients day in and day out. Even feeling like the job is more of a calling is not enough to stop from exiting the profession. A sobering new survey released by Elsevier Health called Clinicians of the Future reveals a prediction that 75% of the healthcare professionals will be leaving the profession by the year 2025. Yes, it is a shocking prediction that, if true, even at a small scale, will have lasting ramifications for the entire world. Indeed, there are a lot of challenges among us nurses in which we all deserve the attention and to address the systems, structures, and policies that create workplace hazards and stresses that lead to burnout, fatigue, and poor physical and mental health. This issue will take on greater urgency over the coming years as nurses are asked to assume a more prominent in advancing health equity. Policymakers, employers of nurses, nursing schools, nurse leaders, professional associations, and nurses themselves all have a role in ensuring the well-being of the nursing workforce. This is definitely a challenge among nurse administrators to help employee retention levels high in 2023 and even in the future. Leaders must go beyond fair and competitive benefits and invest in the components of employee experience that matters most to nurses. Gallup reports that when an organization makes a strategic involvement in employee development, they have 11% greater profitability and are twice as likely to retain employees. I know this is not done in a snap of a finger, but a call of service, commitment, and love to the profession. Nurses, invest in yourself too. No matter how difficult the days may get, don't forget the reason you became a nurse. Also, please be reminded of Lao Tzu's quote, and I'd like to share it with you. Watch your thoughts, they become your words. Watch your words, they become your actions. Watch your actions, they become your habits. They become your character. Watch your character, it becomes your destiny. Again, congratulations to the organizers of this webinar, and I'm very thankful to our esteemed guest speaker, Dr. Jose Arnold Tariga, for giving us your time and sharing us your knowledge and expertise on this. So have a nice day, everyone. Thank you.
Thank you very much, Ms. Romelyn Matutina, ANSAP Iloilo Secretary, on behalf of the President of ANSAP Iloilo Chapter, Helen A. Caton. And we would like to thank ANSAP for taking care of the welfare of our nurses, not only in the country, but all over the world. So there you have it, ladies and gentlemen. We have just heard the message coming from the President of the Filipino Nursing Diaspora, the Governor of PNA Region 6, and the President of ANSAP Iloilo. I have been reading the comments in our webinar chat, and our participants are asking if there is a link for our attendance. So again, there will be no attendance in this webinar. At the end of our webinar later, a link and a QR code will be posted for the evaluation and exchange of your webinar certificate. So please wait for the end of the webinar. A link will be posted or to be given for the evaluation for your certificate. And later on, as you will be listening to our speaker, kindly use the chat box for Q&A. Again, chat box for Q&A. If you have any questions, if you have any thoughts that you would like to share regarding the topic to be delivered by our speaker. And now, ladies and gentlemen, for the formal introduction of our resource speaker, let us listen to the Dean of the Nursing Department of St. Anthony's College, and also the President of ADPCN Region 6. Ladies and gentlemen, virtual applause, please, for Dean Aris Kendall R. Bungabong.
A pleasant morning or pleasant day to everyone. Dr. Jose Arnold Tariga is a nurse with more than 14 years of professional experience in various clinical and educational settings in the Philippines, the United Arab Emirates, and the United States. His areas of expertise include acute and long-term critical care, air quality, and education and training in clinical and academic settings. Dr. Tariga holds a PhD in development education and 2 master's degree in nursing. He is a certified professional in healthcare quality, a certified nurse educator, and board certified in nursing professional development. He has presented at various national and international conferences and webinars and published in peer-reviewed journals. He takes pride in having been recognized as the Healthcare Professional of the Year 2019 by the Filipino Times Awards UAE for being one of the scholars in Sigma Nightingale's Challenge 2020-2021 cohort by the Sigma Theta Tau International Honor Society of Nursing, and for being awarded first place among hundreds of medical educators across the globe for his capstone project at Harvard Medical School's postdoctoral program in medical teaching, Boston, USA. He is currently the Director of Clinical Education and Development at InsightGlobal Health, a leading staffing company in the United States. Ladies and gentlemen, let us virtually welcome Dr. Jose Arnold Tariga. Dr. Arnold.
Thank you so much, Sir Aris, for that very kind introduction. And I just would like to say good morning, good afternoon, and good evening, everyone, wherever you are in the world. I think good morning for those our nurses who are in the Philippines. Good evening for our nurses who are in the US, and then good afternoon, I think, for our nurses who are in the Middle East. And I think we have a lot of nurses who are with us from the different parts of the Philippines. We have nurses from Luzon, Visayas, Mindanao. So magandang umaga, maayong buntag, maajong buntag, because I am from Bohol. So I am so grateful to be given the opportunity to be here with you today and to actually talk about the topic of professional development, because this has always been my passion. But before anything else, I just would like to say or to extend my gratitude to the organizing committee for giving me the opportunity to actually talk with you this morning. Thank you so much to Sir Jerome Abate for tapping me to give this talk. Thank you so much as well to Sir Aris Kendall Bungabong for facilitating this talk, to our officers, Dr. Violeta Lopez, Dr. Rosana Grace Bello de Lariarte, Ms. Romelyn Matutina, and then the St. Anthony's College FiND Network, PNA, Filipino Nursing Association Antique Chapter, and then ADPCN. Thank you so much for hosting this event. So for this evening from my side, for this morning, we're going to be talking about how do we leverage professional development to reroute nurses from the Great Resignation. And I think it was a very good introduction from Dr. Lopez, because she has stated a lot of facts and statistics in terms of the Great Resignation. And I believe everyone has heard of this word all throughout the last 2 to 3 years, especially during the pandemic, right? So I think it is high time for us to actually look into the different factors that could have caused the Great Resignation. And if it will be difficult for us, of course, to address all those factors, maybe look at some of those factors, including professional development, as one of the possible and sustainable ways to manage the Great Resignation. So our hope for this session is that after this session, we will be able to explore the factors related to the Great Resignation among our nurses, not just in the Philippines, but actually across the world. We're going to look at the different strategies that are put in place by our healthcare leaders in terms of how do we address the Great Resignation, because there have been a lot of interventions that are being done. But then the question really is, are these band-aid solutions, or are these sustainable solutions that will last long? And then we're going to explore how nursing professional development can help reroute our nurses from the Great Resignation. And I am also hoping that at the end of this session, all the participants who are here will actually be able to develop your individualized action plan for your professional development. And I know that this might not be very common because being a Filipino nurse, having experienced how it is in the Philippines, sometimes once we finish our bachelor's degree, then I think the pathway is usually going to the hospitals, for most of us anyway. And then sometimes we don't necessarily plan in terms of how are we going to move forward with our professional development. So we just sort of go with the flow, right? Like you work as a bedside nurse, and then maybe at one point you get lucky and you get promoted to a charge nurse position, or you move into a special unit. And for sometimes we go into the academia to teach as a clinical instructor. But if you come to think about it, there are actually a lot of opportunities for nurses, especially nowadays, because there are a lot of specializations that you might not be familiar. So these are some of the things that we have to keep in mind as we move forward in this session, because again, I would want everyone to maybe start looking at how can we as nurses on our own develop our own action plan for professional development. So I just would like to disclose that I don't have any conflicts of interest with the presented materials. So to set the stage for this discussion, I would like to share a very short clip of how nursing shortage is affecting the healthcare systems in the US. And I also have a short clip for the Philippines. So I hope that you can hear the audio. So if you cannot hear the audio, just let me know.
We're watching the system crumble slowly in front of us right now. Now we're just exhausted. Now nurses are just running on empty.
This is a crisis. This is an emergency. This is a cry out for help.
The US Bureau of Labor Statistics estimates that around 500,000 healthcare workers have left their jobs in the last 2 years, most of them nurses.
Nurses have never left the profession in the numbers that we're seeing now, and that means that patients aren't getting the care that they need.
Amanda Betancourt has been a nurse for 18 years. She's also the president-elect of the American Association of Critical Care Nurses.
We just think about the way it's always been or what we've always done, and I think that doesn't work anymore. Since the pandemic began, it's hard to know exactly how many nurses have quit. What we know in my organization is when we ask nurses, are you thinking about quitting? Are you thinking about leaving? 66% of them intend to leave nursing. That's really shocking. Those numbers have never been that high. Yes, we have a staffing crisis, but that's really about retention because we don't have a supply problem. We have a lot of nurses. They just don't want to work in hospitals right now because that environment is tougher than it's ever been to work in. It has definitely brought our healthcare system to its breaking point.
Ria Petule sees the shortage of nurses in the Philippines up close, sitting by her husband Rico's hospital bed. There's no one to attend to the patients, she says. Health officials say 40% of all Filipino nurses have left the country or retired.
We'd like to stop the bleeding as soon as we can.
Maria Rosario Vergara says the Philippines has a shortage of more than 350,000 nurses.
Those recruiting our nurses should also give us some form of exchange so that there would be something for our country.
The head of the Philippine Nurses Association says he's especially worried about high-risk pregnancies in rural areas. There's also strain on those nurses left behind, caring for too many patients.
It would be high risk for an error for the patient.
A better life in Manitoba.
Manitoba's Minister of Labor and Immigration is trying to fill nearly 2,000 nursing vacancies.
We want to make sure this batch that comes has a seamless transition so that they can be gainfully employed right away, and that'll benefit Manitobans.
But there are growing concerns in less developed countries that wealthy nations like Canada are exploiting those with fragile healthcare systems.
It's the higher income, richer countries who are going on this global shopping trip. They are taking from shelves which are already very, very bare and can least afford to lose nurses from.
Nurses in the Philippines are also torn between duty to their country and the much larger paychecks and opportunities abroad.
In God's time, so sorry.
Amir Pagadalan is emotional when he talks about being offered a job by the Manitoba delegation. He says it's a gift from God.
Will be enough to support my family po.
Okay, so I hope you were able to sort of get the gist of the video that we just watched. And based on what you've seen, I think it is very clear to all of us that there is a massive number of nurses who are either planning to leave the profession, that's one. There are nurses who are on the process of leaving the profession. And there are also nurses who have already left the profession. And that's on top of the nurses who are actually resigning from the profession. So if you add all of them up, you will have definitely an idea that, you know, a lot of our nurses are actually leaving not just the workplaces, but also their profession. And the problem with this one is not just necessarily the absence in terms of the number of nurses, but it actually impacts the pool and the wealth of nursing expertise. Because of course, when these experienced nurses leave the profession, you are left with nurses who might not have the experience, or you will not have nurses who will be training the next generation of nurses to become the more competent in their practice. So what we really hope to achieve, whether you're a nurse educator, whether you're a nurse leader, is that we hope to mitigate the massive exodus or the Great Resignation of our nurses. And we can achieve this by providing them with professional development activities and guiding them on how to reroute their career within the nursing profession so that their expertise will be retained. So again, I would like to emphasize that this is my recommendation as a professional development advocate, is that as healthcare organizations, we should not just provide professional development activities, you should also guide your nurses, because you might have a lot of professional development activities in your facility or your organization, but if you do not guide your nurses on how to pursue a pathway that is aligned to what they want in their career, you might still end up with nurses leaving not just your organization, but also the profession. Okay, so before I proceed, I would like to have a raise of hands through a survey and ask whether any of you or your nurse friend, if you're not a nurse, did any of you ever thought of leaving the nursing profession? So to join the survey, I'm requesting everyone to go to www.menti.com and then you use the code 48034926. Again, you can go to www.menti.com and then use the code 48034926. And then ask yourself or your friend whether you have thought of leaving the nursing profession over the last 2 to 3 years. Considering that a lot of things has actually happened over the last 2 to 3 years. So I can still remember, I think, when the COVID pandemic was initially announced in, I think, late 2019. And so I actually graduated from a PhD in 2020, February 2020. And that was the last month before the world closed its doors and before the flights were shut down. So since then, there has been a lot of changes in terms of how nursing is delivered at the bedside, or how nurses have been seen as professionals, or how nursing has been seen as a profession, because we really stepped up a lot, right? And you might have heard, or I know that everyone is aware that, we have been labeled as the frontline heroes, which we are, and we actually have been heroes even before the COVID pandemic. But then I think the COVID pandemic has highlighted the important works that nurses have done. But because of the COVID pandemic, I think it has created a lot of strain for our nurses as well. And many of us, including myself, actually thought of leaving, not the profession, but leaving my workplace and leaving the bedside. So as I can see here with our participants, I think 74%, wow. So the data that we are gathering now, this live data, is actually in alignment to the researches that have been conducted by different organizations, because many of the statistics that has been provided actually talks about 60 to 75% of nursing intending to leave the profession. And that was in 2021, 2022. So I think there's not been a lot of research conducted over the first quarter of 2023, but I would presume that there's not that much changes in the data. And this actually speaks to what is in the research, So thank you so much for participating in the survey. So I have another question after this one. So the next question is, what factors prompted you or your nurse friend to leave or consider leaving the profession? So if you're one of those 75% who thought of leaving the profession, what factors prompted you or your nurse friend to leave or consider leaving the profession? So again, as what I've mentioned, there's a lot of reasons why many of us thought of leaving the profession. So one is stress. Definitely. I think the last 2 to 3 years has been very stressful for everyone, for not just for nurses, actually, for everyone in the world. Salary is definitely one of the most common reasons as well why we have considered leaving the profession. And sadly, being a Filipino nurse, I know how it is in the Philippines. I know that sometimes some organizations might not be paying our nurses very well. I'm not saying that it's all organizations, but there might be some organizations who are not paying our nurses worth. So this is definitely and totally understandable. So like low salary burnout, very common during the last few years. I know that so by background, I'm actually an ICU nurse when I was working in Changhua Hospital in Cebu. And for me, during the time, it was already stressful, taking care of critically ill patients. But then I can just picture out taking care of critically ill patients during the COVID pandemic when the ratios of nurses to patient are very much imbalanced, right? So I know that a lot of us were burned out. And because of the staffing shortage, a lot of us were asked to work extra shifts or extra hours. And that compounds the burnout that our nurses are experiencing. It could also be impacted by a toxic environment or poor management. Sometimes, some organizations might not be able to manage their staff well. And maybe because there's already staffing shortage, they don't necessarily look into the welfare of their staff because they're just after how their clients or their patients will be cared for, with a total disregard of how the nurses are feeling or what are the needs of the nurses working for them. So sometimes, if we are not managing our nurses well, then that's definitely one factor that could prompt our nurses to leave the profession. Okay, so I think we have a lot in here that actually speaks for what, and I think this is again in alignment to what the general public is saying in terms of the factors that prompted many of us to consider leaving the profession, or I would presume that many actually have also left the profession. So thank you so much for sharing your inputs. So just as a heads up, by the way, whatever is highlighted here in bold are the ones that are the most common answers. So that's why you can see your workload, being underpaid, understaffing, which is already a problem even before the pandemic and has been compounded during the pandemic. So all of these factors is definitely valid and real. Okay, so next question will be, let me just try to move to the next screen. What factors, for those, I think there were like 25% who said that they never thought of leaving the profession. So what factors motivated you or your nurse friend to stay? Or for those who actually just stayed, I know that we ask about you thinking about leaving, but if you did not leave the profession or if you did not leave your organization, what motivated you to stay within the profession? So family, definitely. And I think in the Philippines, family, we are a very family-centric country and community. So I think that's one of the main reasons why we would want to stay. Passion for nursing. Oh, I love seeing this one. I believe that this is very important. And I always believe that when you are a nurse, you are very passionate about serving others and about caring. Your patients, definitely. I think a lot of us, especially for those who are working in facilities where they will have recurrent encounter with their patients, will be able to establish relationships with these patients, and sometimes that can hold us, not to leave the profession, but to actually stay with the profession. Salary, this is very good to see here, actually, because that would mean that there are organizations that are paying our nurses very well as well. And I really do hope that at one point we're gonna reach to a point that there will be standardization in terms of the salaries for our nurses in the Philippines. Work environment, friends, I can really attest to that. When I was working in the Philippines, even if I extend for a very long time on my shift, a very stressful shift will just be okay because I have my colleagues with me, I have my friends. So I think that's one reason as well, or one motivating factor for us to stay. Thank you so much again for sharing all of this. And I greatly appreciate you putting in your inputs. Let me just proceed to the next slide. So I think one thing that we have to remember, as much as we were talking about the pandemic, right? We are aware that there is a COVID pandemic. But what we need to consider is actually there is another pandemic of equal magnitude, and that is the Great Resignation of nurses. So healthcare systems across the world are actually ravaged by this pandemic. And this is alarming in a way, because if COVID pandemic has actually crippled, the healthcare system, you can just imagine how the healthcare system will be crippled if you don't have nurses, because we all know that nurses makes up most or the majority of our healthcare providers, right? I would say maybe like 60, 70, or maybe even 80% of the healthcare workforce in wherever you are, like whatever country you are, majority of them will be nurses. And one thing that we have to keep in mind is that nurses have been carrying a lot of problems already before the pandemic, right? So when the pandemic happened, it has compounded what have been experienced by the nurses even before the pandemic. So there has been work-life imbalance because a lot of us during the pandemic were asked to work extra shifts. Sometimes you cannot even go home because there is nobody who will receive you because your other colleague is sick. So that's why we are not able to balance work and life. And then understaffing, and this is one of the factors that you've mentioned that sort of prompted a lot of us to actually leave the profession or to leave our organizations because we are understaffed. And understaffing has already been acknowledged by the World Health Organization and ICN as a predominant problem even before the pandemic. You know, we have been short-staffed, and I'm not so sure, maybe for some of you have looked into the statistics. Philippines, the US, wherever you are, actually, I think there's no country that has actually really achieved the appropriate ratio for their population. There are nurses who have higher ratios as compared to others, but as what I've said, I think there is no country who has achieved that perfect staffing. So there's definitely understaffing. And then there have been resource constraints. So if you can remember, and I can still remember it, like when the pandemic happened, like we were told that we need to reuse our masks, for example. And then I think even in the US, you know, there came a point that they said that you can use your handkerchief or you can use your just a piece of cloth to actually use as a mask. So that shows how constrained the resources are during the pandemic. Inadequate pay for our nurses. I know that there has already been a disparity in the pay for nurses, and it was very evident here in the US, actually. For those who are not familiar, and you might have heard of this in the news, there's this thing called travel nursing here in the US. And for travel nurses, they do get paid a lot, but for the regular nurses working in the hospital, sometimes they don't get paid as much as the travel nurses. So they felt like, you know, there was inadequate pay for me, so why would I keep working? So that also prompted nurses to leave the bedside. Stress, which was one of the most common factors that everyone has mentioned. With all of this happening, of course, you can expect that the nurse will be stressed. There is violence and aggression from the patients to the nurse, from a colleague to another colleague, and even actually violence and aggression to the nurses themselves, you know, self-inflicted aggression. You might have heard of a lot of nurses committing suicide. So this actually, these are actually real, you know, and this actually really happened. I'm not so sure in the Philippines, but in the US, it did happen. Poor work schedules, again, this is because of understaffing. So sometimes you will be asked to work extra shifts, you will be asked to work overtime, and then it messes up your schedule. So sometimes, I think in the Philippines, I think our minimum requirement by the labor is like 40 hours per week. So sometimes you will be asked to work 60 to 70 hours per week. It was sort of the same here in the US. You know, sometimes you will be asked to work overtime. Although I think the thing here is that we cannot be forced to work overtime, but they will like plead for you to work. So then you cannot have your proper rest, you cannot sleep properly. And all of these factors can actually lead to burnout. So if you see all of these points, and this actually resonated to everything that you have mentioned in the survey, all of this have pushed our nurses to the brink of physical, emotional, and psychological exhaustion. And that is the reason why, because of the dissatisfaction and extreme levels of burnout, our nurses, a huge fraction of our nursing workforce, is actually planning to leave or has decided to leave the profession. And this phenomenon has been called many names. It has been called the big quit. It has been called the great attrition, but it is most commonly known as your great resignation. And it literally describes what is happening. The Great Resignation is a great number of nurses and healthcare professionals who are resigning from the healthcare field. And mind you, the Great Resignation is not just in the healthcare industry. It is all over the different industries, actually, because a lot of industries have been affected by the pandemic. So the international statistics say that 52% of registered nurses are actually planning to leave their jobs. And this is a survey conducted by the American Nurses Foundation and the American Nurses Association in 2022. Elsevier Health also conducted another survey in 2022, and they found out that 47% of healthcare workforce intend to leave the profession. The US Bureau of Labor Statistics in 2022 also revealed that 1.6 million people quit their healthcare jobs in Q4 of 2022. This is just in the US. And if I'm not mistaken, 50 to 60% of this healthcare people are actually nurses. So you can just see that it's more almost like either 50 and up are actually planning to leave the profession. So it's very important for us to actually see that. I know that a lot of people are still very passionate about nursing, but because of the factors that they are experiencing right now, even if they love nursing so much, many of them have actually just thought of leaving. If you remember the video that I've shared early in the presentation, the Philippines Department of Health actually mentioned that 40% of our nurses are planning to leave the country and or retiring. And there is a shortage of more than 350,000 nurses, according to the Department of Health. And I think one thing that we have to consider as well, and this is, I think, the difference, in terms of what is being given to our nurses from different countries. I know that in the Philippines, having worked in the Philippines, that sometimes our salary, again, the salaries, the professional development opportunities are not as much as compared to when you work somewhere else. So maybe, for example, if you work in the Middle East, you get better salaries, tax-free. You work in the United States, you work in Australia or in Canada, in other countries. And I think that's another reason why there is a massive resignation, or there's a massive shortage of Filipino nurses in the Philippines. And sometimes, there has been a lot of news I've been reading about the staffing shortage in our country and even in the US. And there's always this question, or I think there was even a point wherein the Philippine government capped the number of nurses who are supposed to go out of the country. And then I asked myself, like, if I was in the Philippines, what would have I felt, if somebody would want to stop me from pursuing what I want or pursuing a better opportunity for me and my family. And I cannot blame nurses if they would want to leave the country, but I really do hope that for those nurses who actually left the country for better opportunities, I do hope that they would also give back, share what they have learned maybe from wherever they are working right now, or still coordinate with their fellow Filipino nurses or fellow Philippine nursing communities or organizations to help out in developing our next generation of nurses. Because at the end of the day, if you come to think about it, we still need nurses there for our families who are left at home, right? So for example, for me, my parents are still in Bohol. And one thing that I always worry about is that if there are no nurses back home, and I'm not even there, and my sister is also a nurse who's working in the Middle East, we're not even there to take care of our parents, right? So we need nurses as well to take care of our parents. So I do hope that, we will still have nurses in the Philippines. But then I would really hope to see as well that our organizations and the hospitals would do better with our nurses. So the increasing number of nurses intending to leave not just the workforce, but also the nursing profession is actually quite alarming because we already have a massive global and national shortage. So again, it's not just in the Philippines, it's not just in the US, it's actually across the world. And in 2021, the International Council of Nurses estimated a need for up to 13 million nurses to meet the global demand, while in 2022, the US Bureau of Labor Statistics projected a shortage of more than 200 nurses annually through 2031. So this 200,000 nurses annual shortage is actually just in the US. So you can just imagine how short will it be if you look into a global perspective. So this figure should actually be a wake-up call to healthcare leaders and organizations because the Great Resignation is actually real. And if we're not going to mitigate the Great Resignation, that will have a disastrous consequences for healthcare in general, right? Because you're going to end up having hospitals that are not manned with nurses. So you can just imagine if you go to a hospital with a nurse, can you imagine inserting your own IV, getting your own medication? A lot of things, because we nurses actually do a lot in the hospitals. Majority of the patient contact time, majority of the services that are provided in healthcare facilities are actually done by nurses. So we should be proud with what we do. And this is the reason I think that, we want to be seen as somebody who is very valuable because we are valuable, right? As a member of the healthcare team. And of course, if we do not mitigate the Great Resignation, we have to remember that we are definitely going to pay the price, right? So for healthcare leaders, for healthcare organizations, if you do not mitigate the turnover of your nurses, of course, you're going to have poor staffing, which will again have a domino effect, which will further cause problems in your staffing. And you will have financial losses. And of course, you will have poor patient care, which will eventually lead to poor patient outcomes. And one thing that we have to remember is that this patient might be our family member, right? And we don't want poor patient outcomes for our family members for sure. Or this could actually be us. Like if you are in the Philippines and you are sick and you need to go to the hospitals and you don't have nurses to take care of you, you cannot expect that you will have good patient outcomes, right? So we have to be very mindful that we cannot go on like this, right? We cannot go on with the Great Resignation or the great exodus of nurses from healthcare. We need to do something. But what we have to keep in mind is that the Great Resignation is multifactorial. You've mentioned all those factors that cause nurses to leave the profession. All of those factors will have different ways of interventions, right? There's no one universal solution to the turnover of nurses. And this is the reason why, like for me as a professional development advocate, I advocate or I promote professional development as one way of maybe rerouting our nurses to not leave the profession, but maybe find a pathway within the nursing profession so that they will be able to still continue sharing their expertise and their experience to the next generation of our bedside nurses. So let's talk about the current strategies to address the Great Resignation. And again, there are a lot of factors that's causing this one, and there's a lot of interventions that has been put in place. But the question is, were the solutions being provided or were the solutions being given, were they sustainable enough to sustain the current need of our healthcare systems, right? Or are these band-aid solutions that will just stop the bleeding at one point, but then it does not necessarily heal the wound, right? So among the current strategies in place is signing bonuses. And again, most of these interventions are actually US based, but I know and I've seen a lot of advertisements from Philippine hospitals that many of our hospitals are actually offering signing bonuses to our nurses, or like are offering better salaries. And that's good, right? Because you need better salaries than before. Like you should be given something that is commensurate to the service that you provide. So this signing bonuses, the only downside of this one is sometimes, you will be sort of tied with the organization for quite some time. I think usually when you sign something, then they will tell you to stay with the facility for 2 to 3 to 4 years, depending on what the contract you sign. So be very mindful as well when you do your sign-in bonuses. But yeah, I'm not so sure if this is sustainable, because yes, you might have nurses who will work for you maybe for 2 to 3 years, but are you even sure that these nurses are happy with you as well as an organization? And remember, if the nurses are not happy, that will reflect on the services that they will be providing, right? So if you're treating your nurses properly and you're just confident that this nurse will not be able to leave just because they've signed a contract with me that they're going to be staying here for 3 years or for 2 years, that might impact the care that they will be providing to your clients and patients. Travel nurses, not very common in the Philippines, but very common in the United States and I think other Western countries. So many of the organizations usually hire nurses from the agencies to offset the massive imbalance in nurse-patient ratio. I know that in the different healthcare settings and different units that we have in the Philippines, for example, there are ideal patient ratios. So for example, when I was working in the intensive care unit, our ideal ratio is 1:1, or like 1:2 if the patients are not so critical and are ready for a are ready to be transferred to a step-down unit. But in medical surgical units, for example, 1:10 to 15. It really depends, and that was my experience. I cannot talk about what is happening right now because I haven't been in the Philippines for more than 10 years. In the US, different states have different laws and regulations in terms of staffing ratios as well. So like if in California, what I know is that I think their med-surg units is usually 1:4 or 1:5. In Massachusetts, I think we have 1:6 or 1:7. In Atlanta, it's almost the same as well. So of course, we expected that during the pandemic, there were a lot of shortages in our staffing, right? So they will usually bring in travel nurses to sort of help for a short term. And then once the staffing need is already addressed, once they're able to bring in more staff, which is not the case, then they stop the travel nurses. So the problem here, again, is what I mentioned earlier, is the disparity in pay. So I think what really caused unhappiness with the nurses who are regularly working in a hospital is that they saw how the travel nurses were being paid 2 to 3 times more than the regular nurses. And this created a rift between the regular nurses and the travel nurses. So it sort of impacted as well the delivery of care, because sometimes the regular nurses would say that, why would I help the travel nurses when they are being paid 2 or 3 times than me, right? And then, of course, travel nurses, they're not very familiar with the policies and procedures of your hospital because they are travelers, like they are new to the system, right? So if they do not know the ins and outs of your system, you will not be assured that they will deliver the highest quality of care as well. So again, from my perspective, travel nursing is a band-aid solution. It's not sustainable, and it's not even sustainable for healthcare organizations to be paying a lot of money, actually. But well and good for those who are into travel nursing for sure, because they are getting a lot of money. Although it has mellowed down, I would say, because I've seen that there has been sort of a decrease in the number of travel nurses, at least in Massachusetts and in Atlanta. But I cannot say that will be the same in some other states. And then another strategy that is being put in place is automating the workflows. Again, I'm not so sure if this is happening in the Philippines, because I know that a lot of our hospitals in the Philippines might not necessarily be technologically equipped yet. But in the US, what they did is they've streamlined a lot of processes, because I think everyone will agree that majority of the things that we do are very administrative, right? So especially here in the US, based on my experience, because you need to document a lot because it will impact the pay from the insurance. You have to very religiously document everything that you did with the patient, because it will also protect you, because I think everyone is aware that in the US, you can get sued with any mistake. So you have to be very particular with your documentation. So this causes a lot of time being spent with documentation, with a lot of other things. And with this actually lessens the time for patient contact. So that's why during the pandemic, they realized that, oh, we can actually use technology to streamline some of these processes, so that our nurses can spend more time with the patient and then less time with computers and documentations and stuff. But if I have to be honest, I'm not so sure if it's also working that much. Having worked in the hospitals here, I think, it all boils down to how complicated sometimes the documentation process can be, especially if it's, you have an electronic medical recording system. You will notice, and this is my experience as a nurse having worked at the bedside here, I can say that I would say that like in a 12-hour shift, I think I spend like 6 to 8 hours being in front of a computer, just because you need to document everything. The doctor's order will be there. If you have to document about the medication, it has to be in the computer. Your assessment is so long. And as much as it's like click, 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 you still have to input something, right? So yeah, we spend a lot of times with the computer. And I would presume that for those who are, I would presume that it will be worse for the hospitals that doesn't have electronic medical recording system, because you will need a lot of time to write your documentations if you have a paper and pen documentation, right? So automating the workflows, it sort of helped, but I hope it can be sustained. But one thing that actually came up was professional development. And I think the good thing about professional development is it promotes re-engagement and increased intention to stay in the nursing profession. Because during the COVID pandemic, I think one thing that many of us and many of the nurses realized is that they don't want to work at the bedside anymore, but they would not want to waste what they have invested. Like in terms of education, in the Philippines, we study nursing for 4 years, and it's not cheap. It's more expensive here, even in the US. So I've also worked as an assistant professor at one point in the universities, and it is very expensive to study nursing here. So in a way, we are very lucky that we study in the Philippines. Our curriculum is equivalent to the US curriculum of nursing, because I think if you study in the US, you'll be paying like 10 times, maybe 5 to 10 times more than what we are paying in the Philippines. And as what I've said, it's even expensive there already, right? So nurses realize that they can actually transition or develop themselves and maybe look into different subspecialties within the nursing profession. And that is in the US. If I have to be honest, and maybe I would love to see some inputs later. I'm going to look at the chat, because I'm not so sure if this is one of the areas that have progressed in the Philippines. So when I was working as a bedside nurse, I can still vividly remember that there was not a lot of pathways, actually, if you talk about professional development in the Philippines. So again, when I graduated from nursing school, I worked temporarily at the Training Review Center for Nurses. And then after a year, I worked in the hospital. So within the hospital system, the pathway was you can go into leadership, or you can go into infection control and healthcare quality. That was the only pathway. So it's either you go up as a charge nurse, or you remain as a bedside nurse, or if you get certifications, or if you're interested, then you can go as an infection control specialist, or work as a quality risk officer or something like that. Or you can move into the academia and work as a clinical instructor and become a professor, right? So, well, at least that was during my time. So I'm not so sure if it has changed. So in the US, what's the different thing about working here in the US is there is a lot of opportunities in terms of professional development. So within a healthcare facility or within a healthcare organization, you can actually move into different pathways or different specializations. So for example, you're a nurse who's into technology, so you can actually you can go for a nursing informatics pathway. Or if you're into nursing education, you can go for a clinical nurse educator role or a nursing professional development role, or even a simulation specialist. If you're into quality, you can be a patient safety officer, a health quality and risk assessment officer. So a lot of things that you can actually look into depending on what you are passionate about or what you like, right? So again, I do hope that this is happening in the Philippines. And if not, I hope that we here who are here today as a team, maybe we can voice this out to our leadership in our country to actually open up more opportunities for our nurses in terms of professional development, because this is definitely one thing that we need to improve on. And I think one thing that I also would want to highlight is that here in the US and some other Western countries, you might have heard of this, that nurses can become nurse practitioners, right? So they can practice, they can have their own clinics, they can practice and prescribe medications, for example. They can do their independent nursing practice. So that's one thing that this sort of one pathway that you can also look into. Okay, so nursing professional development, as what I said, can be considered as a viable and sustainable answer to the Great Resignation. And this is supported by research and studies, right? So according to Shalinor and Poon in 2022, supporting professional education and establishing career ladders reduces turnover and increases retention. Okay, so this is not just me blabbing about how professional development is actually helping nurses or not. It has actually been proven by research. And there was another study conducted by Zhu and colleagues in 2021 that organizations with limited opportunities to learn new knowledge and further career developments encourages nurses to leave their jobs. So this studies, coupled with the studies even before the pandemic, actually really signify that professional development is an important factor that can help reduce the turnover and can increase retention. Because one thing that we have to keep in mind now is that if you are a healthcare leader working in an organization, you do not just focus on recruitment, right? You bring nurses in, but you have to have a plan in place on how to retain them, okay? So that you will also avoid a lot of cost in hiring. So I would presume that for those who are nursing leaders here, you're very aware that you also spend a lot of money actually when you're bringing in nurses in your organizations, the hiring process. So if you lose a lot of them, that means you're also losing a lot of your organization's money, and that will impact the care and the services that you will provide. So professional development is built into nursing practice. And this allows nurses to improve their current practice or move into a specialty that is more aligned with their passion and purpose. So as what I've said, like a lot of the nurses might be tired working at the bedside, but I know that a lot of nurses also love working at the bedside, and that's good. But if there are nurses who are actually interested to do something different, but still within the nursing profession, and if we provide that, if that is something that is aligned to their passion, that is aligned to their purpose, and if we provide that opportunity for them to actually move to that pathway, you can be assured that that nurse will not leave the profession, because they will feel that, okay, I'm doing something that makes a difference. I'm doing something that I love doing, that gives me joy as a professional. So why would I leave when I have this opportunity to move into that pathway? And again, this is the reason why we as leaders, as organizations, should provide different professional development opportunities for our nurses. So how do we facilitate, or how do we initiate providing these professional development opportunities? One thing that I would say though, and this is my experience working in the Philippines and working in the United Arab Emirates, and maybe even in the US, most of the time, professional development and education is usually at the back end in the organization's strategies, right? They will usually just tap even like the education team when there are accreditations or when there are orientations. But other than that, if there are issues in the organization, and this is what I experienced in the United Arab Emirates, when the COVID pandemic happened, our education team was dismantled. The reason why was they wanted us to help in the clinical area. So, and that's okay, you know, I would love to help, but then who will then educate the new nurses that will come in, who will conduct the orientation, who will conduct the competency assessments? So for me, as a nurse educator, sometimes it's very difficult to also talk to executives or nurse healthcare leaders, because sometimes they don't really see the value of education and professional development. So for us to be able, as an organization, for us to be able to, you know, facilitate professional development, you have to upskill and reskill, okay? So when we talk about upskilling, this is the process of learning new skills or teaching workers new skills. So for example, you're an ICU nurse and you have an experience handling a ventilator, right? So learning to use a new ventilator, that is upskilling, okay? That is part of your job as an ICU nurse. Reskilling is the process of learning new skills so you can do a different job, or training people to do a different job. So for example, you're an ICU nurse, but then you are being trained to become a quality and risk officer, okay? So you're a nurse, but then you are trained to do a different job. So that is reskilling. So to facilitate this, first, you have to conduct a skills audit, okay? So you can use surveys, one-to-one interviews to assess the skills of your current nursing workforce. So you have to understand that the pool of nurses that you have in your team or your organizations actually have a lot, they actually have a varied skills mix, right? So you have to understand what are their needs and how can you further hone or develop their skills, right? So what are the gaps that you can identify and that you can work on and train them on so that you can develop these nurses. So maybe you have nurses, bedside nurses who are very good in leadership roles, right? So maybe you can train them to become your charge nurses or your nurse managers or nurse supervisors. And then once you have your baseline data, and once you have conducted a skills audit, then you have to obtain buy-in from the nurses. So when you are introducing something to the nurses, you cannot expect nurses to just embrace upskilling and reskilling, especially if you portray them as quick fixes for your staffing problems, right? So you will just say, oh, okay, let's train this nurse because she is a good, he or she is very good in leadership. So let's put this nurse as an acting charge nurse for the time being, because we still are unable to hire an experienced charge nurse. So it shouldn't be that way. For us to get a buy-in, you have to show that there is actually a proper pathway for growth for your nurses, for example. So let's say, for example, okay, we're going to train you as an acting charge nurse, but then after 6 months, we're going to evaluate how you performed. And if you do very well, then we can put you on succession plan to become the charge nurse and then become a supervisor and then maybe become a nurse manager or even the director of nursing or the chief nurse. So there needs to be a clear pathway that you need to relate to your nurses so that you will obtain buy-in, right? Because it is very important for the nurses to see that they're not just doing this for a short period of time, that there is actually really a clear pathway for them to progress in their career. And then you have to embrace mentoring and job shadowing. So I know that I think the most common way that we are doing this is through preceptorship. But actually, there is more to preceptorship, because usually preceptorship is just like you pair up a new nurse with a senior nurse for the first few days when they go into a hospital or when they go to a specific unit, and then that's it. But mentoring is actually a process wherein you pair up somebody who is very experienced with somebody who is not maybe very experienced, and then that they have the same interest, and then the experienced nurse will actually mentor the nurse on how to become, for example, a nurse educator or an infection control nurse. So job shadowing is also very important. You provide opportunities for your nurses to actually look into other opportunities. So for example, there is a nurse who might be interested with infection control. So if you have an infection control nurse, provide that opportunity for your bedside nurse to shadow the infection control nurse so that they will actually see that, oh, okay, this is something that I'm interested, or maybe that will give them an idea that, oh, okay, I don't want this type of work, so I'm just gonna stay at the bedside. So job shadowing is very important. I do understand that sometimes, it can be very difficult to provide these opportunities. And I guess it goes back to having a staffing shortage, because sometimes when you provide job shadowing and then you don't have enough staff in the unit, sometimes you remove those nurses from their areas, right? So I acknowledge that it can impact, but then if you are very intentional in providing and upskilling and reskilling your nurses, you should have a strategy on how you provide mentoring and job shadowing opportunities for your nurses. And then update your career pathways. So as what I've said, and again, this is me talking about my experience 14 years ago when I started as a nurse in the Philippines. There were not a lot of career pathways for nurses. So maybe try to look at what other pathways can we provide aside from the leadership and management pathway in your organization. Are there other pathways that can actually provide a meaningful transition in terms of career progression for your nurses? Because I'm sure there is a lot of opportunities. Of course, it will entail finances, but then that's a very good investment because you're investing on your nurses. And for sure, these nurses will then pay it forward to the next generations of nurses in your organizations. And you will then be assured that because you have an experienced nurse there who is training your new nurses, you will be giving the same quality care for your clients and your patients, right? So I really do hope, and again, I know that there's a lot of international nurses, Filipino nurses from the US who are trying to give back, promote this professional ladders, professional development in the Philippines. I hope that it will really materialize because this will be very important for our nurses back home. Okay, so what I just recently talked about is for nurse educators and for nurse leaders. So it's sort of centered on as a nurse educator, as a nurse leader, or as a healthcare organization. You play an important role in promoting or in developing professional opportunities, professional development opportunities for your nurses, right? But the question is, yes, let's say, for example, I'm a chief nurse of a hospital, and then I created a lot of different career pathways. Okay, let's establish this pathway for infection control nurse, for nursing informatics, for nurse educators, for leadership and management nurses. The problem is, am I guiding my nurses? Am I guiding the bedside nurses in terms of what they can do to actually create their own pathway and move to that pathway? Because if you do not guide your nurses, then what's the use of having those professional development opportunities? And with this one, this is now a shared responsibility between your nursing leaders and yourself. Us as nurses, we need to know that we can actually chart our own path. We can actually reroute or reroute your professional development journey. So I'm going to go back to this a survey because I would want to know if any of you have a professional development plan. So whether you are an old nurse, or maybe you are a nurse who have been in the profession for quite some time, or you're new. I mean, if you're new to the profession, did you start with a professional development plan? So like when you became a nurse, I was like, okay, this is the pathway that I'm going to follow through. I'm sure that this is what I would want to do as a nurse. So I just would like to have an idea whether any of you have developed their own professional development plan. And it's so nice to see that actually majority of you have a professional development plan. This is very promising because this means then that many of us are actually aware now that you can develop and that there are specialized pathways that you can go to, and that's very good. And I so love that a lot of us are actually looking into professional development, because you need that, you know. I know that, again, there are a lot of nurses who are happy to just be working at the bedside, and that's amazing because we need bedside nurses. But there are also other nurses who would want to move to a different specialization. So for example, myself, I want to teach, you know, and by teaching, I do not limit myself by teaching in a school or by teaching in a hospital. You know, you can be an educator, for example, in different settings. So again, there are a lot of opportunities for us that we need to explore, and I hope opportunities that will be provided by the organizations and by your hospitals. But if there is no opportunity in your organization, chart or find your own opportunity. Okay, don't be limited. Don't be limited by your environment, because you are actually empowered to chart your own professional development plan. So thank you so much for sharing this one. And again, you know, this is something nice to see that a lot of you actually have a professional development plan. Okay, so on the talks of professional development plan, for this next sessions, I would want you to actually grab a piece of paper and a pen if you have in there, or like if you can, you know, just type some notes in your computer, because we're going to have some short pauses as we discuss the different strategies, because I want you to sort of reflect, especially for those who don't have plans, and maybe for those who have plans already. Maybe some of these strategies might help you, and I would welcome any information that you would like to share as well in terms of your strategies, your personal strategies, and how you develop yourself as a professional. But I would like to quickly share how I ventured into professional development. So as what I said, I finished my BSN in Holy Name University in Bohol. I started in nursing 2004 to 2008. So when I graduated, I immediately took the board exams, worked for a bit in a review center in Bohol, and then moved to Chongmo Hospital to start working as an ICU nurse. And then because of the need to earn more, because I would say the salary before was not that much, you know, it was not enough to sustain my needs, because I was also studying my master's at the time at Cebu Normal University, and I felt like I didn't really have the money. So I was like, okay, I need to start looking for opportunities abroad so that I can earn a good amount for myself and so that I can give back to my parents. Because I think this is a cultural thing, right? I am the eldest in the family, and I feel like I need to help my parents, and then I need to provide for my siblings. So I did just that. So in 2013, I decided to move to the United Arab Emirates. There was an opportunity, and at the time, if I have to be honest, I was really scared to move to the Middle East, because you hear a lot of stuff when you move to the Middle East, right? But I was so grateful that I was able to move to the UAE, lived and worked there for 9 years, and experienced a lot of stuff there professionally. So I started as a bedside nurse and then worked very hard. And then in 2015, I was promoted as a charge nurse. So I think for those who haven't been to the UAE, and for those who have been or who are still in the UAE or in the Middle East, one thing that I experienced was that there is definitely a difference in terms of how Asians and how Westerners or how Arabs are being looked at in different settings. One thing that I've realized is that it's not very easy for Asians to actually get the promotion or to move up the ladder, just because they have a different perspective in terms of our training. And for me, that's quite sad, because I have I strongly believe that the quality of education that we have in the Philippines is actually amazing. The fact that it is equivalent to a US degree actually really speaks a lot in terms of the quality of our curriculum, right? But then again, you know, I guess it's a cultural thing or it's a country thing. So in the UAE, and again, this is my experience. I'm not speaking for anybody else's experience. This is what I've experienced personally as a professional working in the Middle East. So that's a disclaimer. So my experience was that, you know, if you work as an Asian nurse with a Westerner, Westerners usually get paid more than you for the same job. And that goes the same with your promotions, for example. So for example, it took me 2 years to get promoted to a charge nurse with all the hard work that I have. But for my Westerner counterparts, like it took them 6 months or less than a year to get the promotion just because they're Western trained. And that has always been the justification when I was in the Middle East. You know, you don't have Western training, you don't have Western qualifications. So it was very hard for me, just because I'm really into professional development. And I always believe that if you are qualified, if you have the experience and you have the qualifications, you should be given what is due, right? You know, we work hard, and I always believe that you're supposed to get the fruit of your labor, right? So because of the difference, I guess, in perspective, when there was a restructuring of the leadership of the organization that I was working, the new leaders did not necessarily like Asians to be in leadership position. And this was one of, I think, the darkest moments in my career, because I was demoted from a charge nurse to a staff nurse again. And you can just imagine how frustrated I was, because, you know, I worked so hard for 2 years to be promoted to a charge nurse. And then suddenly, just because I'm Asian, I'm not Western trained, I was demoted back to a staff nurse. So I felt like the hard work that I invested in terms of my career was just put to waste. And I sort of underwent, not severe, but like I did have mild depression the time. I would say, like, for 6 months, I was very aloof, and I tried not to participate, because I was very active, you know, before I was promoted to a charge nurse, and when I was a charge nurse, I was very active within the organization. So I felt like, why should I be active if it will not matter anyway? I have been demoted. But then one day I realized that if I'm going to keep that mindset of, you know, feeling sad for myself and not picking up myself, I realized that it will be me who will suffer the consequences of it, right? So something just clicked, and I realized that, okay, I need to pick myself up again, and I need to work hard again, not for these people, but for myself. You know, I need to, like, find something for myself. So I tried to contemplate and reassess, what do I really want? What am I really very passionate about? Is it really leadership, or is it something else? So I realized at one point that I'm actually very passionate about nursing education. So at that time, there was an opportunity to work as a clinical resource nurse, which is sort of a counterpart of a nurse educator, a clinical nurse educator. So I applied for the role, but then because I don't have Western qualifications or Western training, they said that we cannot give you the full job. If you want, you can be an acting clinical resource nurse, but you will not get paid for it. You will not get the official title. You will not get certificate of employment as a CRN, because you are not officially a CRN. You are still a bedside nurse. So I said that, okay, I'm gonna take it, because I just want to experience it, and I love teaching. Maybe this is something that that I will be growing into, you know. So I did take on the role, and I think when you find your niche, you know, when you find what you are very passionate about, things will start falling into place. So I started developing myself. So I really pursued. So at the time, actually, while I was in the UAE, I also started doing my doctorate in development in nursing, development education. And then aside from that, because everyone there is always saying that you don't have Western qualifications and stuff like that. So I started looking into certifications from the United States. So I went for the CPHQ, or the Certified Professional in Healthcare Quality. I looked at Certified Nursing Educator from the US as well. So these are some of the things that I did, some online studies. So I really invested a lot of my time, my efforts, my energy into professional development. And I felt like, you know, it sort of paid off. So in 2018, there was another hospital that opened, and they were looking for a nurse educator. And as what I said, when you find your niche, things will just align. So I applied for the job, and then I was offered the job. So I became the clinical resource nurse of that hospital, built the education team of that hospital from ground zero. And then, so I mean, like, I've left my old organization, moved to a new organization. But the funny thing is, in 2020, my old organization changed their leadership again. And this time, that was the time that I was so active in LinkedIn. And for those who are not active in LinkedIn, I would encourage you to be active in LinkedIn. The reason is that you will be able to connect with a lot of nurses, leaders, and healthcare professionals whom you'll find somebody who might be having the same interests with you, and you can learn a lot from them. So in 2020, my old organization contacted me that they need an education coordinator or an education manager. And then they saw that, my profile fits their need. And I said, like, I am actually from your organization, but then I was not given the opportunity to work in a managerial position because I'm not Western trained. But then when they saw that I have my certifications from the US and stuff, so they said, like, you are actually Western qualified because you have some qualifications from the US, plus you have your doctorate and stuff like that. So they hired me back and paid me a better salary, equivalent to a Western pay. So I was like, okay, I'm gonna take the job, not just because of the money, but because I really did enjoy working with my old team. They were a good team, and if you get paid for it, then why not, right? So I did that. I did move back to that old organization. I was very happy there after moving back. And then at that time I was processing for my US. And then I realized that, again, there might still be limitations for me in terms of career growth, just because the environment is like, in the Middle East is like that. And maybe for those who are in the Middle East right now, you might be able to attest this one. I'm not bad-mouthing or anything, but again, this is my personal experience. So I sort of pursued my plan to go to the US. And in 2022, I received, I think in December 2021, before Christmas, I received my visa to move to the US. So I transplanted myself to the US, worked initially as a bedside nurse. And you see, this is a good thing. And this is, again, my experience. What I really enjoyed here in the US is that there were a lot of opportunities for me, and they did not look at me as a Filipino, as an Asian nurse. They looked at me as a professional with a lot of qualifications, with a good experience. So within just 4 months of working as a bedside, I was able to find a job in the academia here. So I was hired as an assistant professor in one of the universities in Massachusetts. And so I was teaching nursing students here in the US. And eventually, before the end of 2022, I was offered a job to be the director of clinical education and development for my current company. So it just shows that when you are able to find your passion, when you're able to find something that you feel is your purpose, and you invest your energy into it, there is actually opportunity for you to grow and develop your professional pathway. So I'm not so sure what will happen next here, but I'm hopeful that things will just continue moving up. And even now that I'm here, I'm still continuing my professional development activities. So I still try to study, I still try to participate in organizations to learn and to also give back to the community. So having said that, having shared my experience, I've sort of developed some strategies that, again, many of you might have developed already, because you said, like, I think 75% of the participants who are here today have their professional development plans. And if you do, please share that in the chat room. We will be happy to, share it with our colleagues who are here with us today, so that we can also learn from you. So I sort of developed my ABCs to rerouting my own professional development pathway. So my ABCDE starts with A, ascertain your passion and purpose. So as what I've said, when I had my demotion, there was a time for me, there was a turning point for me. There was a time for me to actually reflect, what am I passionate about? I asked myself, what is my why? Is my why leadership? Is my why education? And I realized that for me, my why is really I felt like my purpose was really education, because I like to share knowledge. And when I was looking back, I remember that when I was still working as an ICU nurse, I really like to precept new nurses, share what I know as a senior ICU nurse. So it's very important for us to actually really know, what is your why, what is your purpose. If you're familiar with the concept of ikigai as well, I would encourage you to assess your ikigai. So ikigai is a Japanese term for your life's purpose. And with ikigai, the way we usually do ikigai, or finding your ikigai, is to answer 4 questions. So first is what you love. Okay, so what do you love? What are you good at? What does the world need? And what can you be paid for? And if you are able to answer all those questions, you will find your sweet spot, which is called your ikigai, or your purpose. So for example, for me, and I found my ikigai retrospectively, because I did not learn about ikigai not until recently, when I started studying about professional development and stuff like that. So for example, for me, when I ask myself, what do I love? So I love teaching, I love knowledge sharing. What am I good at? Well, I feel like I'm good at teaching. I feel like I'm good in sharing knowledge. I feel like I'm very good in translating information so that it will be digestible. It will be easily understood by, for example, patients or by nurses. What does the world need? I felt like the world needs a lot of nurse educators, a lot of mentors, a lot of coaches, right? And what can I be paid for? I can be paid for as an educator. I can be paid for as a mentor or as a coach. So that's why for me, I felt like I have found my ikigai. And maybe this is not ikigai necessarily, but for me, I just feel like, yeah, teaching, educating, knowledge sharing is my ikigai. So if you're not familiar with ikigai, I would encourage you to sort of look into the process of ikigai. So this is where I mentioned earlier, where if you have a pen, or paper and pen, or if you want to share in the chat room, it will be very nice if you have other ways of how you ascertain your passion. Do you ask yourself why? And if you haven't asked yourself what is your why, or what is your ikigai, I would encourage you to, after this talk, during the weekend when you're lounging along the beach, wherever you're in the Philippines, maybe have a think and have a reflection on, what is really my why? Am I happy with where I am right now? Because if you're happy, then that's good, right? But if you're not, try to find your ikigai, because how amazing would it be if you are doing what you love doing and you get paid for it, right? So that's always that's always the thing that I always tell some of the nurses that I coach. Like, yes, you can work there are a lot of different nursing jobs that pays very well, but do you love it? Are you enjoying it? Or are you dragging yourself to work every day? And yeah, money is good, but then at the end of the day, when you're so burnt out because you don't necessarily enjoy what you are doing, I don't think money will matter at the end of the day. So it's always good, again, to find what you're very passionate about, find out what is your purpose, find your why, find your ikigai, and then work towards it. So once you have ascertained your passion and purpose, the next step that I usually do is to build a SMART plan. And this is building a plan on how you can achieve your goals. So I think as nurses, all of us is so familiar with this acronym SMART, right? So when we were nursing students, we were always told that, oh, okay, when you develop a nursing care plan, you have to develop a SMART plan for your patients. So S is for specific, M is for measurable, A is for attainable or achievable, R is for realistic, and T is time-bound. So for example, when you are developing a plan for your goal, let's say, for example, my goal is to lose weight. If I say that I want to lose weight, is that a SMART plan? No, because it is not specific. You cannot measure it because you did not attribute the weight factor of it. Is it achievable? Yes, it can be. But then again, you cannot measure whether you have achieved it or not. Is it realistic? Yes, it can be. And then is it time bound? You did not mention your time frame. But if I say, if I state my plan, I want to lose 5 kilos by March 30. That is very specific, right? You can measure because you said that you want to lose 5 kilos. So you can weigh yourself now and like weigh yourself at the end of March and see if you really lost 5 kilos. Is that achievable? Yes, if you work hard, right? And then is it realistic? Yes, it is realistic. Or I think it is realistic. Is it time bound? Yes, because you gave yourself a deadline, the end of March. So again, planning is not enough. You have to make it a smart plan. You have to make sure that you are very specific about it, that you can measure it, and that it is time bound so that you will have the opportunity to actually review whether your goals or whether the things that you've set for yourself has been achieved on your specified timeline. And if you haven't achieved your goals in your specified timeline, it's okay. Okay, don't be so hard on yourself. Maybe one thing that you can do is to actually review your strategies, because maybe your strategies is not working for you. Maybe you need to re-strategize, right? Or maybe you need to make a new plan. Okay, so don't be so fixated into just one strategy, one plan. Be flexible as well. So just to share, like for me, I always believe in the power of visualization and manifestation. So what I usually do is that when I'm developing my own plan, for it to be smart, I have my short-term goals, short-term plans with specific dates and timelines, and then I have my long-term plans and goals. And I usually put it somewhere strategic, somewhere where I can see it every day, so that when the time comes that you feel tired of working towards your strategies, then whenever you go and see your goals, you will be reminded. And actually, I think I've started reading about this, the science of visualization or manifestation. And actually, it is sort of linked to how your subconscious captures this information and keeps reminding you that this is what you aim for yourself, right? So if you haven't done so, I would encourage you to do it. Put it anywhere. Put it in your kitchen if you love cooking, so that while you're cooking, you'll see that, okay, this is my plan for myself for the next 2 to 3 years. I want to be this. I want to finish this. I want to work on this. Put it in the toilet, because every one of us, we go to the toilet every morning. Put it in your mirror, because I would presume that we want to see ourselves every day. So like for myself, I always go to the mirror every day. So put it anywhere that you can see it, so that you will be reminded that these are my goals for myself. These are my plans. And manifest it, visualize it, declare it, whatever you I always believe in the power of declaration. Whatever comes out of your mouth is very powerful. So you have to give life to your goals. After for some of you who are planning to take NCLEX, declare that you're going to be a USRN or whatever certifications you are planning to take. Declare that you will pass that certification, because you will. Okay, of course you have to work hard and believe in yourself, but you will. Okay, keep that in mind. So once you have built a smart plan, another thing that I do is I create a priority list. The reason being is that you can end up with a lot of plans and goals. So like if I go back to my old slide, you'd find there like a lot of plans and goals there. But you have to make sure that you prioritize, because each of your strategies, each of your goals and plans will require different amounts of time, energy, even finances. Like for example, if you want to study, right? It depends on where you want to study. Maybe you want to study in the Philippines. And by the way, I guess everyone is aware, like when you're studying masters in the Philippines, those are actually equivalent to the masters in the US. You just need to have it evaluated for equivalency. So, because when I was in the Middle East, like some people were telling me that, oh, what you're studying your doctorate in the Philippines, because in the UAE they don't recognize the doctorate from the Philippines. But then when I moved to the US, I just have it reviewed for equivalency, and it was recognized. I got a job as an assistant professor. So we should not belittle the quality of education that we have in the Philippines, because again, it is accepted, especially here in the US. I cannot speak for UK, Australia, and Canada because I haven't worked there. But whatever you have there in the Philippines is equivalent here in the US. Okay, so we should be proud. So create a priority list. If you don't have a structured way of creating a priority list, it really also depends whether what is most important to you. But what I usually do is I have this priority matrix. It sort of looks like this. So there are 4 quadrants of my matrix, and then it starts with one side is on the impact, the other side is on the effort. So it starts with impact, it starts with low to high impact, low to high effort. So whatever is high impact, low effort, that is what I do first, because that means that I will have a quick win and it will give yourself a boost that, okay, I am able to actually achieve this now, and small wins will actually will fuel your desire to do more and to do better. So that's why it's always good to start with your quick wins. Do now. Then the next thing that you should prioritize is those with high impact and high effort. So those are the major projects. Those are the things that you need to do next. If that is something that has a low impact in your life or professional development and low effort, then you can do that later. But if that is something that has very low impact and you have to exert a lot of effort, then don't do it. Okay, so I think that's one thing that you have to remove from your list of priorities, because what's the sense of doing something that is not impactful to your life? Okay, and this is how you weed out the activities that you are doing. And once you have prioritized, it's always important as well to develop an accountability system. One of the common mistakes that we do is that once we plan something, we hold ourselves accountable. But you have to be able to be, I think everyone has to accept that sometimes, as much as we feel like we are accountable with something, we are also very flexible with ourselves, right? So sometimes if we do not perform, we just say, it's okay because I deserve to rest. For example, when if you are into going to the gym, I don't go to the gym, but like if you go to the gym and then sometimes you have your lazy days and then you will say that, it's okay, I will not go today because I deserve to rest because I work hard, like 3 12-hour shifts over the last 3 days. So this is where you need to find somebody who will make you accountable of what you set for yourself. And this is important it is important to develop accountability partners, right? So find somebody who will hold you accountable for your goals. So this can be somebody who is for example, a trusted friend, a family member. If you have a mentor, that will be good. If you have a coach, that will be good. I know that the concept of mentorship and coaching is not, and I hope it's common now in the Philippines, but during my time, it was not very common. But here in the US, it's very common to actually find a mentor if you feel like you need to improve on something. So I hope that that will become common in the Philippines as well, because it's actually very helpful. And you can definitely tap a lot of nurses. So for example, our leadership in our nurse leaders who are here in this webinar today, and for those who are new nurses who might want to venture into nursing leadership, you can definitely tap the experienced nurses and ask them how do they move towards the pathway of leadership. So when you have an accountability partner, you have to be very honest with your accountability partner that this is what I want to do. So if and when I start failing or if I start lagging in terms of what I aim to do, you have to come to me and tell me straight that I'm not doing this, that I should do it this way, okay? Because your accountability partner will help you reroute you back to what you plan for yourself, okay? So again, it's very important. And I think goes back to the gym example. I've heard that if you go to the gym, usually it's always helpful to have a gym buddy so that your gym buddy will tell you that, today is our session to go to the gym. So you have to get up of the bed and stop sleeping because you were supposed to go to the gym. And I think this is the reason why for those who have gym buddies and stuff like that, a lot of them are very successful in, for example, losing weight and achieving what they want for their physique, just because there is somebody who keeps reminding them on what they have to do. And as what I mentioned earlier, coaching is very important, right? It's very important to tap people who are experienced, who have the expertise. So for example, if you want to venture into nursing education, you can tap our educators. If you want to work in the academia, tap our clinical instructors, our professors, and tell them that I actually would want to work as an instructor in 1 to 2 years. So can you teach me what is the pathway? What do I have to do so that I can be like you? So develop those partnerships. Don't be scared to ask for help, because this is a very common thing. I think in the Philippines, during my time, is sometimes we feel like if we ask for help, it's seen as a sign of weakness. So it is actually not, okay? So when you ask for help, that is actually a sign of strength, because that would mean that you are aware of your needs and you are actually taking steps to help you become better, right? So coaching and mentoring, don't be afraid to ask for help. Look for coaches, look for mentors who are willing to work with you in terms of achieving your goals. And my E is embracing change and discomfort. It is very important for us to go out of our comfort zone. And I know sometimes, like it's very difficult to move out of the comfort zone, because why would we make ourselves miserable, right? But if you do not embrace change, if you do not embrace discomfort, you will not grow. I think that's the only way for us to grow, to actually experience the discomfort. And looking back with my experience, when I had the demotion, of course, at the time, I would not say that that was a good experience. It was very difficult for me. I had a hard time accepting that I was demoted because I worked hard for it. But then as I was moving forward in my career, I've realized that the discomfort that I've experienced actually helped me become the person that I am right now. It helped me look at the silver linings, of the negative things that has happened. And it really helped me develop the resilience in terms of professional development. So nowadays, like, if I'm faced with a lot of challenges, I don't easily give up, because I know that I can do it. And one thing that you have to remember again is that you don't have to do it alone. You can actually ask for help. There are people around you who are very much willing to help you out. So those are my strategies in terms of how I reroute myself for professional development. So first is assess your passion and purpose. You build a SMART plan, make sure that it's specific, measurable, attainable, realistic, and time-bound. Make sure that you create a list of your priorities, and then develop an accountability system. Have an accountability partner, somebody that you trust, who also looks after your success, who will be happy for you to achieve something. And embrace change and discomfort. Stay out of your comfort zone, okay? And don't be afraid to ask for help. So the view from a distance. So we've talked about how nurse leaders, healthcare organizations can provide professional development opportunities. We talked about how we nurses can chart our own pathways for professional development. So one thing we have to consider is that a lot of the nurses, based on the survey that we just had as we started the session, a lot of our nurses are heading to the exit door of their organizations, exit door of the nursing profession. But if we have professional development opportunities in place, and if we guide our nurses in their professional development journeys, we can be assured that this can somehow help in preventing the Great Resignation and the exodus of nurses from their organizations and from their profession. So I hope that if we have nurse leaders here, healthcare organization leaders who are here today, you'll see the significance of professional development in mitigating the Great Resignation. And if you're a nurse, I hope that you will not give up. As much as it is very challenging nowadays in our healthcare systems, I hope that you will actually chart your own path and find your why, and find and develop ways on how to move into the specialty that you want for yourself. So these are my references. Thank you so much. And I would love to connect with all of you in LinkedIn. As what I've said, LinkedIn has provided me with a lot of opportunities to network with experts as well, with healthcare professionals who are very passionate about what they do. So if you are in LinkedIn, please connect with me, Jose Arnold Tariga. If you are not yet on LinkedIn, I would encourage you to create your profile. I think LinkedIn is like a Facebook for professionals, but it's very professional, not very Facebooky. So I'm not saying that there's something wrong with Facebook, because I also have my Facebook, but with LinkedIn, you can find work opportunities there. You can also showcase what you can do, and maybe the opportunities will knock at your door if you showcase what you can do. So that is the end of my session. Thank you so much. And I'm gonna give it back to you, Sir Alfred.
Wow, and thank you very much, ladies and gentlemen, Dr. Jose Arnold Tariga, the Director of Clinical Education and Development, InsightGlobal Health in Atlanta, Georgia, USA. And that was a very fruitful and meaningful discussion on leveraging professional development to reroute nurses from the Great Resignation. And of course, we agree that one of the strategies that can stop nurses from going to the exit door or leaving the country and going to other countries for better work opportunities is that there should be professional development opportunities in place, and also guidance in their professional development journey, of course, provided by our nursing leaders, our mentors in the nursing profession. So during the discussion, we have learned the various factors that are causing nurses to leave the profession. That is why we coined the term the Great Resignation. We also identified current strategies employed by healthcare leaders all throughout the country and organizations, and their effectiveness in addressing and managing the exodus of nurses. And it also provided us with the discussion of the viability of providing professional development opportunities to better the competencies and capabilities of nurses, to promote nurse retention, as well as to increase their expertise. And also a personal sharing of our speaker, Dr. Tariga, on how to start our professional development journey to consider in rerouting our nursing careers. And I believe there are questions, so please type in your questions in our Q&A box. And again, a lot of participants are asking about the link for the evaluation. At the end of the webinar, a QR code and a link will be shared. No attendance link for today's webinar, but attendance is monitored through Zoom participation. And later on, after evaluating our webinar, you'll be given your certificate of attendance. And now, ladies and gentlemen, before we proceed to our open forum, let us have an intermission number to be given by one of the nursing students of St. Anthony's College. Ladies and gentlemen, let us listen to a song number to be given by Kristen Jane Asmod.
Good day, everyone. My name is Christine Jane Asmod, a third-year nursing student from St. Anthony's College, and I'll be singing Paubaya by Moira de la Torre. Saan nagsimulang magbago ang lahat? Kailan nung ako'y di na naging sapat? Ba't di mo sinabi nung una pa lang? Ako ang piling niya, hindi ko na pipilit pa. Ang tanging hiling ko lang sa kanya, huwag kang paluhain at alagaan ka niya. Saan natigil ang pagiging totoo? Sa tuwing mapabanggit na mahal mo ko, ba't di mo inamin na merong iba? Ako ang kayakap, pero isip mo siya. At kung masaya ka sa piling niya, hindi ko na pipilit pa. Ang tanging hiling ko lang sa kanya, huwag kang paluhain at alagaan ka niya. Ba't di ko naisip na merong hanggan? Ako yung nauna, pero siya ang wakas. At kita naman sa iyong mga mata kung bakit pinili mo siya. Mahirap na ba na nang tinadhana? Pinapaubaya, pinapaubaya, pinapaubaya ko na. Sa kanya.
And there you have it, ladies and gentlemen. That was Kristen Jane Asmod with her rendition of Moira's song Paubaya. And of course, no, I was reading to some of the comments, no, in our webinar chat during the intermission number. Of course, hindi naman dapat nating paubaya yung mga OCA and SRA benefits. We just have to wait, no, for the Department of Health to actually release it. So once again, thank you very much, Kristen Jane Asmod. And again, we are inviting our participants. If you have questions in line with our topic, leveraging professional development to reroute nurses from the Great Resignation, kindly use the chat box to type in your answer so that we can read it live, and our guest speaker, Dr. Jose Arnold Tariga, can answer it. So at this point, may we invite back our guest speaker, Dr. Jose Arnold Tariga, for our open forum. And we have a lot of questions here in our Q&A box. And please allow me to read some of the questions. Okay, so first here, we have a question coming from Sir Jerome Babate. So Dr. Arnold, we have a question here from Sir Jerome. It feels like nurses have always been required to be incredibly resilient. They are expected to behave heroically. But nurses are also human beings, and we're seeing a rise in clinician burnout. Is mental health a new issue for nurses, or have they been suffering under the radar for longer than many of us might have suspected? Dr.
Um,
Arnold?
Thank you so much, Joffrey, for facilitating that question. Sir Jerome, thank you for the question and for acknowledging that mental health is a very important aspect and one of, I think, the most talked about topics that we are having right now, actually, with this pandemic. In terms of resilience, yes, we nurses, I guess, are really resilient just because we are so exposed to a lot of challenging situations in the hospitals. But to your question about mental health, if Sir Joffrey, I'm not so sure if I remember the question properly, but I think the question was towards whether mental health is a new problem. Is it right? Sorry, Sir Joffrey, you're on mute.
Again, sir, is mental health a new issue for nurses, or have they been suffering under the radar for longer than many of us might have suspected?
Yeah, so thank you so much for clarifying the question. So I believe that mental health has been a problem even before the pandemic. I think the pandemic highlighted actually that there is an ongoing problem with mental health among our healthcare professionals. It also compounded, I guess, the mental health problems and issues that we have been encountering just because a lot of the things have been doubled, if not quadrupled. A lot of the problems that we had previously before the pandemic has been doubled or quadrupled during the pandemic. So for example, like burnout and stuff who has a very big impact with our mental health. Staffing, not having enough time for rest, a lot of patients dying, which definitely impacts, like for me, if I see a patient dying in the ICU, that already impacts my psychological health, for example. But then if you see a lot of them dying at the same time, you can just imagine how that impacts our nurses. So for sure, it has been an ongoing problem, but the pandemic has highlighted that there is that problem that needs to be addressed.
Yes, thank you very much, Dr. Tariga. We agree that nursing indeed is a stressful profession. And since our upbringing in the nursing profession is for us to be resilient, we are duty bounded. That is why the common approach here is that we have to prioritize first. We have to think first of the welfare of our patients before ourselves. And that perspective changed recently, wherein you cannot give what you don't have. You cannot care if you don't feel you're cared.
Exactly.
Dr. Tariga. That is why one of the approaches recently is also for the protection of the mental health, the well-being of our nurses, for them not to be able to give the best quality care, for their patients. Okay, so let's move on. Another question here is coming from Jill Mail Yarena. The points raised to address the Great Resignation resonates with me as a nurse manager. Based on experience, I agree that professional development is one of the effective strategies to keep nurses engaged and motivated. In line with the Great Resignation, I wanted to get your opinion on short-term strategies to address quiet quitting. Quiet quitting is a trend that I am seeing in different organizations as well. Personally, I feel that quiet quitting is significantly worse than the actual resignation, as this will directly negatively impact patient outcome and quality of work. Doc?
Thank you so much for bringing that up. Actually, yeah, quiet quitting is very common nowadays. And quiet quitting has been there for quite some time, actually. I think it has also been brought up just because of the pandemic and because of the notion of the Great Resignation. In terms of the question of what can we do for the short term, so firstly, I would actually encourage us to actually envision something for the long term, but for the short term, the best way, and this has always been a conversation here, even in the US, is for us to actually talk to our nurses and listen to them in terms of what they want. Most of the time, as nurse leaders, we are so blinded by the goals or objectives that are being set for us by our executives, by the higher management. So for example, like we want your unit to have this number of patients so that we can gain a lot of income and stuff like that. And because of that, because we want to please the upper people, for example, we tend to not necessarily like care. I'm not saying that you don't care, but sometimes we stop talking to our nurses because we just go to the units and tell them, okay, this is what we have to do. But if we actually take the time to converse with them and ask them, what is it really that you want, or what is it really that you feel can help our unit or can help you so that you will be able to effectively deliver your care, I think that will help us. And actually, that with having that conversation will actually help you identify solutions, because as nurses, I think everyone can attest to this. As nurses, because we are working in the front lines, we know the problem and we have the solution to that problem. I always believe, especially Filipino nurses, I'm just so proud to be a Filipino nurse, because we are so creative with a lot of solutions. You might have seen a lot of our nurses doing something that is not very commonly done, and that's because I think it came out from the, for example, lack of resources. That's why we tend to be very creative. So going back to the point of the short-term solution that can be a long-term solution. Talk to your nurses, ask them what they feel can be done to solve their problems. Each of the nurses will have a different problem. That's one thing for sure. And there will never be, again, a universal solution to quiet quitting and the Great Resignation. But if you talk to them, you as a nurse leader might be able to identify that, okay, this nurse actually just needs a time off because they need some family time. So maybe you can give that to them, organize the schedule and do something. Oh, this nurse just needs an extra time to work on his or her postgraduate studies. So maybe you can organize that as well. So yeah, that would, for a long-winded answer, bottom line is talk and ask and listen to your nurses.
Yes, Dr. Tariga, we agree, no? Nurse manager should really talk and look at the person behind the nurse. Behind the nurse, there is a person there that have their own needs. That is why we are talking about resignation, and we identified that the cause of this resignation may be salaries, wages, career opportunities. But I think one of the quiet aspects of resignation here is maybe the lack of recognition of the person, of the nurse who are there, working, in our hospital. So mentorship, support, empathy, compassion with our fellow nurses, maybe one of the barriers that can help in preventing our nurses in leaving our hospitals as we value them. So we have another question, Dr. Tariga. I would like to combine the question of Christine Cruz and Diana Aubrey Mamingo. The question is, if we do have a career development plan, but not all of us has the capacity to upskill, because reality-wise, nurses here in the Philippines are not well compensated. What other ways can we do for us to implement our CDP without the need to bring out an amount of money? And I will follow na lang the question of Christine Cruz that Dr. Tariga, can you share with us online courses that can be helpful for our nurses for professional development in line with this question for career development plan? Dr. Tariga.
Thank you so much for the question. Actually, that's a very valid question. And if I have to be honest, when I started my professional development pathway, when I started doing my master's in the Philippines, it was also very challenging for me because it's expensive. So, I know that it sort of sounded easy that, create your plan and do something. But the reality is if we want to develop ourselves, sometimes aside from the effort, the energy, and the time, we also have to spend money. And to the point, that was one of the reasons why I decided to move to the UAE, because I needed money to support myself, my professional development plans. But to that point, like I'm not saying that there are no opportunities. There are scholarships. That's one thing. The only thing then now is we need to sort of look into the availability of those scholarships and whether that scholarship is really aligned to what you have. Because majority, and this is what I'm seeing in the Philippines anyway, majority of the scholarships that are being offered are necessarily research related. So sometimes you are required to submit a research proposal, for example, for you to be granted for you to receive the grant for that scholarship or something. There are definitely other scholarships that are, for example, US based. I'm not so sure as well, because I'm not so sure what your specialty is, but maybe if you're really interested, I can help you explore, connect with me on LinkedIn, or so that, because this is the thing, when we develop when we have our professional development plans, there are other people that we can tap. And this is the reason why I strongly encourage everyone to widen your network, because the more network of people you have, not just within the Philippines, but even abroad, those networks will help connect you with opportunities for professional growth. One thing is also, which sort of entails the financial side of it, is being a member of professional organizations like PNA. Like I'm not so sure if any of you are familiar with Sigma Theta Tau. There's a fee, but then once you're a member, you will receive a lot of professional development opportunities for free under your membership. So you might need to shed out a little amount of money, but then the return of investment that you're going to be getting will be a lot. In terms of available online resources for professional development, again, it depends on what you would want to pursue or venture. I would suggest that you look at Coursera. It's an online platform which is a lot of professional development opportunities that are given for free by a lot of US-based and UK-based institutions that are credible. There are even like courses from Harvard Medical School, from Yale, from Stanford Healthcare that you can look into. And if there are other things that are specific, like if you want to have healthcare quality, Institute of Healthcare, I forgot, it's the acronym is IHI. They have some patient safety courses for free that you will get sort of like a certificate after you complete it. There are other organizations, but if whoever asked the question, if you have something specific that you're looking for, I'll be happy to assist you, connect with me, and then we can spend time together looking for those specific learning opportunities for you.
Yes, Dr. Tariga, thank you for that wonderful insight. I would like to emphasize, you said that the membership in a professional organization, accredited professional organization, can provide you with continuing professional education or development activities, and that is very good. Like here in the Philippines, since the implementation of the CPD law, a lot of nurses or other professionals coming from other professions are in clamor that they are against this CPD. And now they turn to our accredited professional organizations. And for one, PNA is true to its commitment, the Philippine Nurse Association. They have been providing free CPD activities for nurses in a monthly basis. The important there is membership is very important, of course, to access all this. Another is, we would like also to take this opportunity. We are very thankful that the Filipino Nursing Diaspora Network is also very generous, and was very enthusiastic in partnering with St. Anthony's College, as well with the ADPCN, the PNA, and the ANSAP to reach out to all of our nurses. We have 8,000 who registered, and now we have 4,600 who are in attendance. And this activity is for free, sponsored, of course, by the Filipino Nursing Diaspora. So we are together in this endeavor in our CPD. Your professional nursing organizations are with you, in your quest for continuous professional development. By the way, Doc Tariga, we have several participants who ask if they can get a copy or access your slides. They were interested in the topic you shared, and they would like to share it as well in their workplace, in their hospitals. I think these are nurse managers who would like to further inspire their fellow nurses. And another personal question for you, Sir Dr. Tariga. This came from Ruden May Hamolo. Was there a time in your career that you also thought of leaving the nursing profession? And what did you do to tell yourself to stay or to choose to stay? Dr. Tariga.
That was a very good question. And yes, there was a point in my career that I really wanted to leave the profession. That was during the COVID pandemic, actually. So when during the pandemic in 2020, when it started, I think everyone is aware that, you know, nobody in the healthcare system knows what to do. So like I was working as a nurse educator, but then my healthcare leaders at the time asked me to do the nursing education educator bit and at the same time take care of like 2 to 3 ventilated patients. So for me, I was overwhelmed because like, how can you expect me to teach the new nurses who comes to the hospital at the same time still take care of 3 ventilated critically ill patients? So at that point, like I felt like I wanted to leave the profession because I just felt like it was not worth it anymore, you know. The salary was good, but then I was so stressed because I think as nurses, we always have this desire to deliver the best care that we can. And once you start experiencing like a gap in the quality of care that you deliver, you will feel that you are not an effective nurse. You know, you're not effective in what you do. So at that point, I was like, okay, I want to leave the profession. But then I also realized, I think what I told myself at the time was that I've invested so much in this career just to give up because of that unpleasant experience during that time. So what I did is I asked for help. You know, I spoke with them that this is not what I envision for this role, and this is not a realistic expectation for the role that you are asking me to teach and at the same time care for patients. I ended up leaving that organization. So I think, and it was not easy, you know, of course, I'm also a very practical person. I don't risk losing my job without finding opportunities because I cannot lose money, you know, we need money in a way because we need to sustain, I need to sustain my needs. I need to sustain my family back home. So I looked for a job, I found a job. So I moved there and I was happier. So yeah, what helped me was I reflected and I talked myself out of it, recollecting that I've spent a lot of tears, a lot of money, a lot of energy and effort. So if you're at the point that you are about to give up, just remember that you've studied 4 years in nursing. You've worked so hard to be where you are right now, you know? So as much as it's challenging, I do encourage you to just reflect and maybe look at other opportunities to divert or reroute your development pathway. Maybe if bedside is too much for you, you don't have to stay at the bedside. There are a lot of other opportunities. So yeah, that is what happened to me.
Thank you very much, Dr. Tariga, for sharing your personal take on that. No, what we see here is that not all times we are at high points in the nursing profession. There will be times that we are at our lowest, and I think the blaring message is for all of our nurses to support one another, be an inspiration, no, to each other in order to help lift those nurses who are in their low points, in helping them to stay in the profession. As mentioned by Dr. Tariga, you've already invested too much. You endured the 4 years in nursing education. You passed the board exams. You're already, you know, in a work that makes you happy. And at that certain point, you are at your lowest. No, we look back at this inspiration and try to find more reasons why we have to stay, why we have to fight, and why do we have to continue. I have last 2 questions, Dr. Tariga. I think we still have time. Another here, I think this is coming from the academe. This is from Akiko Shaira Kodizar. She is a clinical instructor and she wants to try and help nursing students to grow their passion in nursing without using what we call the abroad plan. I think this is get an experience and then go abroad. And she also do not want to give them false hopes, but at the same time, want to give them practical options or plans. So Dr. Tariga, any advices or tips for our clinical instructors how to inspire their students to create or develop their career path or plans in staying here in the Philippines for work?
Yeah, thank you so much for that question. I think that is a very important question and a very important topic actually that we all have to think about. because I know that there's a massive exodus of Filipino nurses to outside the Philippines. And in fact, Philippines is the number one supplier for nurses in the US. So thank you so much for bringing that up. From my perspective, I would say that I think the best way is to actually really be a good role model for the students in terms of what impacts nurses can do within the Philippine community. Maybe involving them in mission, medical missions, or some community activities. Because for me, to be honest, like when I finished my degree, I did not necessarily think of going abroad, not until I needed the money and stuff like that. But what I really enjoyed, when I finished my BSN, before I took the board exams, I actually served in the healthcare center in my barangay in within my town, and it made me realize that nurses are actually doing a lot that is helping the people who are underserved. Like we usually walk into the far-flung areas of our town, giving vaccines, providing health education. So I think if we let the student nurses see that they are actually making a difference in people's lives within our community, that might hopefully inspire them to actually stay within the country. But of course, on top of that, I hope that our government, or maybe our leadership, especially in the healthcare leadership within the country, will also see that nurses need to be paid what they're due. I think it's high time for us to actually recognize that nurses are doing a lot. They are giving so much in terms of healthcare services. So nurses should be well compensated. It's one thing, I think, aside from showing them that they do make an impact in the community. Give nurses a good salary, good pay that will sustain their needs so that they won't have to leave the country.
Yes, Dr. Tariga, we agree with that, no, especially in the viewpoint of the academe. The clinical instructors, the nurse educators will always be the inspiration of their students. They are the ones who the students want to become after finishing school. So how the clinical instructors carry themselves, if they show that they are happy with the profession, they are inspired to work, it will give their students the picture that, oh, it's nice to work pala here in the Philippines. No? Our nurses are happy, and it inspires them. And also you mentioned about salaries. Actually, we came a long way. We have been battling. We have sent nurses even in the Congress to fight for our cause, for the full implementation of our 9173, our Philippine nursing law, from salary grade 11 to salary grade 15, in which our nurses are enjoying now, our hazard pay, our remunerations, especially during the COVID-19 pandemic. It's always a problem about OCA, about SRA. And the government are hearing us actually. First is the implementation of salary grade 15. It's a big leap for nurses. We are very happy for that. And as well as other nursing professions or positions, I mean. And the benefits for our nurses. But I think a lot more action is needed. That is why the voice of the nurses should be consolidated. We should speak louder, express louder our causes so that the government and, of course, the people will hear us. Maybe that is one of the reasons why nurses are leaving, because the pay is syempre lesser compared to that of those working abroad. Dr. Riga, may I also recognize, also joining us here as panelists, aside from Dean Aris Kendall Bongabong, who is the president of PNA Antique Chapter, we have Sir Frankie Mosones, the president of PNA Iloilo Chapter. Sir Frankie, good morning. Likewise, we have Ma'am Bethel Basinag. Ma'am Bethel Basinag is the president of PNA Bacolod, or PNA Negros Occidental Chapter. And Sir Jerome is here. Sir Jerome, good morning, and thank you for joining us. And Dr. Riga, one last question before we end our open forum. This is an interesting question coming from lovely Lacson. Some institutions don't value the well-being of their nurses. They're up to income rather than addressing their nurses' needs like emotional support and the rest. That is one of the reasons that also led to the resignation of some nurses. Even how compassionate you are, time will come that it's better to let your career down rather than seeing you one day as one of the patients due to emotional stress at work. Are there any institutions or groups, forums that our nurses could run into if they needed some counseling, motivation, and could help them voice out their feelings for them to be guided on their dilemma that won't lead to quitting their jobs? Dr. Riga?
Thank you so much for bringing it up. And actually, that's a very sad reality. A lot of healthcare organizations sometimes, as much as healthcare is a service-driven industry, most of the time it's also perceived as a business. And maybe I need to tap on like you, Sir Joffred, Dean Aris, on how to answer this question, because I'm not very familiar in terms of the available support that is present in the Philippines right now. One thing though that I can say, me being in the US, and I know, in the US, majority of the organizations here have been better in terms of providing those support systems. So for example, in the organization where I work, there is actually a service for counselors that people who are in distress or having mental health issues can actually go and talk to in confidence, so that they can, vent out what they are feeling. So, Sir Joffred, if you don't mind, can I tap on you? Because I'm not so sure if PNA is providing that type of service as well to our nurses. So is there any organization in the Philippines, from the Philippine side?
Yes, Dr. Tariga, the PNA is also active, no, in of course supporting our nurses who are in crisis, those who are experiencing, their down moments, no, in the profession. Our presidents are here. Maybe one of them, Sir Aris, Sir Frankie, Ma'am Bethel. I think Sir Aris or Sir Frankie would like to share some of the programs, no, currently that PNA is having in order to support our nurses. Sir Aris or Sir Frankie?
Sorry for putting you in the spotlight. It's just that I'm not very familiar with what are the opportunities there in the Philippines, and I don't want to give false answers. So
Yes, Dr. Riga. Sir Aris, Sir Frankie, I hope you can join us. Sir Aris is here.
Hi, hello. In terms of support to our nurses, the PNA, no, as the accredited professional organization, is always ready. I think PNA has a lot of programs, different aspects. Actually, there are a lot of committees in PNA. We have nurses who are chairpersons, and nurses, who needs support should just tap PNA National or through their chapters. That's why we are conducting webinar series. Even the PNA National is conducting, aside from CPD webinars, they have kapihan sessions that tackles other work-related aspects, of the nursing professions. So if on the questions, or if PNA has that support, yes, it is.
Okay, thank you for that, Dean Aris. So I guess that's for that question. So PNA has been there. Even our hospitals, they also have their own programs or interventions, like for example, psychological first aid for our nurses, caring for carers, and other related programs that can help nurses who are experiencing burnout, compassion fatigue, and other problems related to the delivery of care. And I guess that would be all for our open forum. It has been a fruitful discussion, together with our speaker, Dr. Jose Arnold Tariga. And there are still a lot of questions coming in our chat box, but unfortunately, our time is running out. So with that, we would like to award the Certificate of Appreciation to our speaker, Dr. Jose Arnold Tariga, for sharing his invaluable time and expertise as resource speaker in the webinar entitled Leveraging Professional Development to Reroute Nurses from the Great Resignation, with program accreditation number NRS-2022-264-3495, approved with 3 CPD units, given this 18th day of March 2023 via Zoom webinar. Signed, Professor Violeta A. Lopez, FiND Network President and the CEO. Signed, Dr. Rosana Grace Bello de la Riarte, Governor, PNA Region 6, and signed by Dean Aris Candel Arbungabong, Nursing Dean, St. Anthony's College, and the President of ADPCN Region 6. Once again, ladies and gentlemen, a big round of virtual applause, please, for Dr. Jose Arnold Tariga. Dr. Arnold, thank you very much for your time and for your expertise shared to all of our nurses. We have 4,700 participants in this webinar. Any closing words or parting words from you, Dr. Tariga?
So you're welcome, and thank you so much for giving me this opportunity. Actually, I'm very grateful for the 4,700 nurses who are here, because it just shows that you are really considering, to develop your own pathways for professional development. I just would like to re-emphasize that you don't have to journey alone. You have us, you have me. So if you need further guidance, if you need to have an accountability partner, as what I've mentioned earlier, I'll be happy to do it for you. So just, I'm just a message away. So I think we have to remember, and I think I would like to re-echo what Sir Joffrey had mentioned earlier, that as nurses, we need to help each other. And for us to be able to help you, you need to ask for help. So don't hesitate to ask for help. And if you are in the capacity of helping our fellow nurses, also extend that help. So thank you so much, Sir Joffrey.
Thank you very much. And once again, a big round of applause, please, for Dr. Jose Arnold Tariga. Thank you. You inspired all of our nurses this morning on how to avoid exiting from the country and developing their own professional competence and expertise. Thank you very much. We are indebted to you, Dr. Tariga. And with that, before we have our closing remarks, can we request all of our panelists in attendance? We have Doc Jerome Babate, Sir Aris Bongabong, Sir Frankie Mozones, Ma'am Rachel Marie S. Yasay, Ma'am Bethel Basinag, to kindly open your cameras. Let us have our photo op before we close and evaluate this webinar. Okay, so I can see here Sir Jerome, Ma'am Rachel is also here. Okay, so ready? 1, 2, 3, smile. One more. Okay, there you have it, ladies and gentlemen. Thank you for our photo op. And now to formally cap our webinar, leveraging professional development to reroute nurses from the Great Resignation, let us listen to our webinar organizer, the Nursing Dean of St. Anthony's College and the President of ADPCN Region 6. Ladies and gentlemen, Dean Aris Kendall R. Bungabong.
Again, good morning to everyone. And in behalf of St. Anthony's College, ADPCN Region 6, and our collaborating organizations, PNA Region 6, the different chapter presidents, ANSAP Iloilo, and the other ANSAP chapters, I would like to extend our heartfelt gratitude to Dr. Jose Arnold Tariga for accepting the invitation to be our resource speaker. And at the same time, I would like to acknowledge the Filipino Nursing Diaspora, Sir Jerome Babate, Dr. Violeta Lopez, for the opportunity for all of us to host this webinar series. So this is already our third webinar with Filipino Nursing Diaspora and the second for the year. So I would also like to take this opportunity to invite our nurses. The next CPD webinar that we will have is on May 6th. It is the Filipino Nursing Diaspora Day with the theme Filipino Nurses Together, Strength in Caring for Global Health. So the guest speaker is Dr. Leo Felix M. Jurado. So we will be posting the details and the link once we already have the approval for the CPD. And for our evaluation, so this is our link. In as much as we want to provide the certificate real time after the submission, due to the bulk in the number of registrants, the certificate generator has difficulty in terms of sending. So we will be sending the certificate in 1 or 2 weeks, or you will be receiving your certificates or the link in obtaining the certificate in your email. So I would like to remind everyone to kindly input the correct details of especially your email address, so that the certificate will be sent directly to your email. So we have encountered several problems wherein a lot of participants were not able to get their certificate because they inputted the wrong email, wrong spelling, or errors. And we are only given a number of weeks for the submission of your names to PRC for the CPD. That is why for those who were not able to send the evaluation, we can no longer give the CPD credit to you because we already have submitted the report to PRC. So rest assured that we will try our best to send to you your certificates as soon as possible. And given the bulk we have 4,700 participants here in the Zoom webinar, and those watching via Facebook Live. So again, thank you, and see you in our upcoming webinar.
Okay, there you have it. And that was Dean Aris Kendall Arbongabong. And currently, the evaluation form link is flashed on your screen. Kindly scan the QR code. You can also access it through the link https://bit.ly FiND webinar. Evaluation March 18. The link is also available in our chat box for the Q&A. You can access it through the link if you don't have a QR scanner. It's also available in our chat box. Okay, so there. Sir Alice just shared it.